Thank you all for coming this morning. We're really thrilled to have Dr. Roberta A, who is Vice Chairman of the Department of Integrative Medicine, join us this morning to speak on an update on integrative pain management. You probably know that we've had a strong commitment in the department to try to introduce complementary and alternative medicine techniques as part of a comprehensive pain management plan for patients. It's very challenging, but having the now Department of Integrative Medicine here and the Center for Health and Healing, which relates to that department as part of Continuum, has offered this enormous resource. So we've really been so thrilled to have all opportunities to work with and collaborate with Dr. Lee and Dr. Merrill and others from that department. Dr. Lee recently completed a 7-year term as being the medical director at the Center for Health and Healing. For those of you who are new to Beth Israel and haven't seen it, there are a few new people in our department. You may want to just take an hour and look at that place. It's quite amazing, and it's a nationally acclaimed interdisciplinary model for providing complementary and alternative medicine strategies in this integrative medicine format. Dr. Lee continues now as Vice Chair of the Department of Integrative Medicine here, which is the first integrative medicine department in an academic medical center. For those of you who are here when we established the first Department of Pain Medicine and Palliative Care in an academic medical center, you can relate to the excitement that they felt and the chairs here felt when we did this for the first time in terms of academic medicine, in terms of integrative medicine. Her book is The Super Stress Solution, and it was just released on January 12th, 2010. I'm sure all of you have copies. Her research interest for over a decade has been in the traditional use of medicinal plants in Micronesia, where she's visited many times. The New York Botanical Garden has a program there, and she is a member of the Board of Trustees on the American Botanical Council. And in 2004, she co-edited a text on integrative medicine called Integrative Medicine Principles for Practice. So Dr. Lee is accomplished and experienced and an academic presence both here and nationally, and she is here to talk to us about integrative pain management.
Thank you very much for that introduction. And in conclusion, little housekeeping. There are a lot of slides on your handouts, and I actually modified them and reduced them, but unfortunately the first version of this lecture was printed. And I understand that the second version, which is a little more truncated, is actually available to you on the web. And I also submitted 2 articles which I thought would be of interest for future academic discussion, which I'll be discussing very shortly. So in the fairness of disclosure, I am the author of several books which we're going to discuss the principles of. And really my objectives are to have a very broad overview of the integrative strategies for pain management, really discuss the physiologic components of stress, actually a new form of stress, which I think we've arrived at without realizing it, thus renaming it so that we can kind of deal with it a little more effectively on a clinical level. Review some of the selective studies which I think are interesting and germane to all of our mission in improving pain management. And actually, I'm going to name some of the things that I think are helpful on a clinical level in terms of lifestyle management. Share with you what I say to patients because we don't have that much time, and we've sort of perfected over the last decade at the center some tricks in trying to do too many things in too little time, as we all know what that feels like. I'm not going to discuss the mechanisms of pain. There are so many, and I know you are very familiar with them. But just to allude to the fact that there are different broad categories: nociceptive pain, neuropathic pain, and what I want you to think of in terms of pain and general wellness are some themes that are common to both. That is, what happens when we have a disease, we get out of balance. There is an excessive physiological strain, which Bruce McEwen at Rockefeller University has coined as allostatic load. And I I'll just leave it at that. But basically what it represents is a micronutrient deficiency state. We know that with most chronic diseases, even those that are not classified as inflammatory, there's an upregulation of inflammatory cytokine mediators. And then there are the psychogenic components, which in the old model of thinking of what happens when we're emotionally distressed, and what happens in the body, we thought of as a segregated event. But we realize now with more neuroscience mechanisms to study these things that maybe that's not the case. I think for every clinician, at least with the tools that we have at hand, psychogenic pain is probably one of the most challenging aspects, especially in the realm of chronic pain. And there's a close correlation between those feeling physical pain and the psychogenic psychological aspects. Sometimes after getting to know the patient a lot more, we realize that maybe in some instances the psychological effects of something that happened historically to that patient really is the beginning of how that psychogenic pain became a pain problem, and a problem for which they either saw me as a primary care physician or you as a pain specialist. And it really doesn't mean that the person isn't experiencing pain. They really are. You know this very well. But somehow I think we haven't been equipped to think of it quite as effectively as we could. And even if we understand this aspect about the patient for which we're working with, even if we know it, if they don't evolve into a pattern of self-awareness, we can't really do that much. Anais Nin said, we don't see things as they are, we see them as we are. It took me 25 years of working in the clinical arena to really get that. At the 10th year mark, I began to see the psychogenic aspects, how they worked for that patient. But then the work really became in the last 10 years of really understanding how to unwind that for the patient, how to enable self-awareness. And that was one of the major reasons why I began to write this book that we just released. But you all know this. If that person experiences anxiety, then your effectiveness in reducing pain diminishes. And here's a study, it's very small, which alludes to that fact. So when we're looking at approaching pain management from an integrative perspective, I think you're already ahead of the game. You're a multidisciplinary specialty to begin with. So what are the things that become enhanced as we bring in this word integrative? Well, it's really widening your range of what is multidisciplinary from my perspective. And many of these things are put in this bucket of complementary and alternative therapies. I think it's a misnomer, especially when we think of the evidence that we now have in acupuncture. I think we need to take that nomenclature out and think of it more as a healing art, which is integrated into what we're doing. It is a heightened focus on lifestyle management. We all know it's great to tell people to have physical activity, to have stress reduction, to be with our family members. But now I'm going to even give you more evidence why it is really, truly important, and that we have to make space for it. So if I had an algorithm and it was a picture, this is the picture that I have in my brain. The things in the ovals are the first three things that I focus on for anything, pain, diabetes, etc., and everything in between, including pharmaceuticals, is really a tool to be used as indicated. So I alluded to the fact that there are 4 domains that we sort of heighten in an integrative perspective. It's stress management, diet, regular exercise, and psychosocial support. And I think these are the things that we have been able to see that could help. Here's a survey done by the National Institute of Health looking at all of these alternative therapies and what kind of symptoms people seek to have treated. Here we have back pain, neck pain, joint pain, arthritis, and most of this stuff is chronic anxiety, etc. Not a surprise, I'm sure.